So culture and diversity is most important in any healthcare practice, in any healthcare service, among the interdisciplinary team members and staff. So culture is a core element in the delivery of healthcare services and influences how patients and families understand, experience, and respond to health interventions at all life stages, including later years and end of life, which is older adults and seniors and towards end of life. Culture is very important, and we should try to incorporate cultural beliefs as much as possible without endangering the patients. There are some cultural practices that we really cannot, and we'll explain to the patient or the caregiver and the family why we cannot recommend or support them using or doing whatever that routine or ritual may be. But as much as possible, we should try to incorporate cultures, because if we say everything is bad, no, you can't do that, the patient is going to turn off, and we're going to lose that relationship that we try to build with the patient and caregiver. Older patients may have traditional health beliefs and a lot of folk medicine. A lot of, I know Caribbeans, South Americans, Hispanics, there are a lot of health beliefs and folk medicines that we use and believe that they work. And some do work. We're coming to realize that some of them actually do work, and they're being incorporated into modern healthcare treatments. So it's not all bad, but it's not all good either. And as I said, this is an opportunity for education and teaching, and also behaviors that they may be ritualistic, that they've known about, their parents have done before, but may not be helping them. And we should try to, as best as possible, try to discontinue that without making it seem like, you know, it's something bad and they should never have done it in the first place. But again, an opportunity for teaching and education. Culture facilitates and impacts patients' adherence and treatment and recommendations by us, making decisions about healthcare choices, meaning of life, their rituals associated with death and or dying, coping with illness, death and or dying. Culture determines the role of family, who's the head of the household, and the place of everybody else in that hierarchy, sex-related norms, treatment of older adults and children. Usually older adults are very revered, and usually they have control of the household, and children are usually, as my parents tell me, seen and not heard. So that's something you should be aware of. If the children in the household are not able to verbalize their beliefs and their wishes, that's again another opportunity for education and teaching. Religion, most important in a lot of cultures, and spirituality. So religion separate from spirituality. So their religious customs, and then spirituality, what they believe as far as the composition of the earth and environment and climate, and their related rituals that go along with that. Preferred foods, some cultures prefer hot foods over cold foods, and if you try to offer them cold foods, it's a big deal, and they view that as bringing on illnesses. So preferred foods and media choices, where they get their information, use of cultural practices, again, or folk medicine, versus Western healthcare recommendations and treatment. So sometimes our patients will say yes, 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 if it's not explained to them correctly, or they're not sure why we're giving them these medications. They'll say, yes, I'll take it. And then later on, if you're doing a pill count or they bring their medication back, you'll find out that they have not taken any, and it's because there was some miscommunication between their beliefs, what they think is for, our recommendations, and their cultural practices, or their preference for their folk medicines. Many older adult patients and community residents at SUNY Downstate are first-generation immigrants with none to minimal health literacy. They may also be the first in their family to have health insurance and access to routine, affordable health care. And they are financially able to afford preventive health care and wellness visits instead of sick care or problem-focused care. So most patients are used to only going to see a healthcare provider, going to the doctor when they have a problem. For us telling them, no, you need to come in when you're not sick, so we could discuss having this test or having this vaccine to prevent you from getting something later on, is sometimes foreign to them. And that's, again, another opportunity for teaching and education. So preventive health, prevent the illness before it happens instead of treating it once it's happened when it's maybe more advanced, not treatable, or require more resources, healthcare resources, financial resources to treat or to cure. And they also may be unfamiliar with or mistrustful of Western healthcare practices and treatments. So again, education, treatment, building a trusting relationship between you and your patient or community resident. Patient-centered care, which is what we practice on our service and what our grant is advocating, and we're trying to make it the standard, not just a research format for healthcare, is patient-centered care cannot be provided without an understanding and appreciation of patients' cultures, values, beliefs, and practices. Understanding, appreciating, and incorporating patients' beliefs, values, and attitude prevents stereotypes, prevents biases, facilitates the development and delivery of a service that meets their needs and what matters to them and what matters to their family or caregiver. So it's an opportunity for teaching. We can actually learn from our patients and our caregivers and families, something that we may not be aware of, something that we thought may be bad, that once they explain why they're taking it, we'll be like, oh, light bulb goes off, now I see why they're doing this. And again, always an opportunity for education and teaching. And that's the end of my presentation. Thank you very much. Hope it was informative. These are my references, and now you can continue to the post test. Thank you very much.